Welcome back, my friends. It's time for Newsmax TV's wide-ranging conversation with Health and Human Services Secretary Alex Azar. He sat down with our White House correspondent Emerald Robinson earlier today.
Thank you, Secretary, for sitting down with us. I want to just go ahead and get to what has been a really hot topic this week, the WHO, walking back those statements on the asymptomatic spread, for saying that it wasn't very concerning, now adjusting that. So which is it? Are we concerned about the asymptomatic spread?
Oh, absolutely. We're concerned about asymptomatic spread. We've got a fairly large percent of people that are testing positive or asymptomatic. We see, when we actually test them, we see the viral load, which is what forms the base of the droplets that can transmit, that can be just as strong as somebody who has symptoms. So we don't know what the WHO was thinking with what they said. There was no evidence or data behind what they said, except, frankly, they were repeating the Chinese talking point that WHO had been repeating for quite some time back in January and February.
Now, you've said that we're working to safely reopen. Clearly, we're seeing more states reopen now, getting back to work. We're talking about putting kids back in school. But just yesterday, Dr. Tony Fauci suggested that this coronavirus, what he calls a nightmare, is not over. He suggested that we could have a strong recurrence in the fall. In fact, he said it was inevitable. If that's the case, will we see another shutdown?
I don't anticipate that we would be seeing shutdowns again. As the president said, if we saw shutdowns, that's what we call community mitigation efforts like that, I think you would see things that are much more localized and focused on the conditions in a very particular area rather than nationwide solutions.
So you're sounding like you're saying it's not necessarily inevitable that we'll see a recurrence in the fall, or to the degree that we saw in the spring. Dr. Fauci sounded pretty certain that he expects a recurrence. However, in January, he was also suggesting that this wasn't going to be so bad for Americans and that they didn't have to really be concerned. So can Americans have confidence in what Dr. Fauci says?
Well, I think it's dangerous to make firm predictions about a virus, especially one like this, where we're still learning about this virus and its characteristics and its traits. What we can do is prepare. So we prepare with that 6-part strategy. And again, historic levels of testing. So we'll be able to see if we're getting outbreaks. So let me give you an example. What we're seeing right now, we've got about 60 counties that we call hotspots that we're looking at, that we're really focused on, where we see prisons, long-term care, so nursing homes, meat packing facilities, situations like that that are outbreaks. Now, we don't want to see any cases arise, but the good news is we have the tools to deal with those kind of localized outbreaks. We can surge the state, locals, we at CDC can surge in, we test everybody, we contact trace, we isolate, we treat individuals, and we deal with any type of community spreading from that. That's really been the driver of a lot of the cases that we're seeing right now. Now, could we see ongoing, see further outbreaks or community spreading? Absolutely we can. One simply cannot put this virus in a box and predict what it will do, but what we can do is have the surveillance systems and testing systems, healthcare systems, and public health capacity to deal with it if it does.
So talking about community spread, I mean, a lot of Americans are wondering why, say, they can't have regular church services. And then we saw thousands of protesters take to the streets, and blue state governors who have been so concerned about reopening didn't seem concerned, and even medical experts didn't seem to have the outrage that we had seen when talking about reopening. So did the protests and the George Floyd backlash essentially cancel the coronavirus for a while?
Well, first, let's be really clear that there's a long tradition of protest in the United States, especially where we have cases of grotesque injustice, as we saw in the George Floyd case. But we also separately can be getting back to our communities, getting back to work, back to school, and as you said, I'd like to get back to worship. We can do that in a way that's safe.
Do you expect to see spikes across the country due to these protests?
We are aggressively looking as we reopen, as we've seen these protest activities. We're obviously aggressively looking through our surveillance systems. We don't see indications yet, but it's probably too early to see manifestations yet, but we're watching very closely.
Are you happy with what you're seeing in states that have reopened, like Georgia, Florida, that has less restrictive measures now based on the data?
Well, so far we haven't seen indications that reopening has made an impact. We see these types of congregate setting outbreaks, as I mentioned, prisons, skilled nursing facilities, meatpacking facilities, but we haven't yet seen in places like Florida, Georgia, Texas that have reopened. We haven't seen broad-scale community transmission that you would seem to connect to that reopening activity. Again, because people can do so in a way that's safe.
Okay, I do want to touch on Operation Warp Speed. Do you still expect to have a vaccine by the end of the year? That is very ambitious. And how do you decide who gets it first?
Yeah, so President Trump confronted these drug companies who were saying how long it would take to get a vaccine or to get therapeutics, and he said those timelines just aren't acceptable. We can put the entire weight of the U.S. government, the Defense Department, all of HHS behind it. We can work private sector and public together, and we can change that. And so, yes, we have a goal of getting vaccines by the beginning of next year for enough for 300 million for all Americans to use. Now, we're also engaged in the work of thinking about, as those products come out in more limited supply, where would they go? Right. It's very hard to do that in the abstract until you know the clinical safety and efficacy profile of the product. Is one vaccine better for senior citizens? One better for healthcare providers? A lot of
parents are concerned about schools. Are you all going to put out federal guidelines on reopening schools in the fall?
Yeah, we're gonna keep providing guidance to schools, so kindergarten through 12th, higher education, workplace guidance, guidance for critical infrastructure work settings, nursing home guidance. That's what we do, is we put out that type of guidance about testing strategies as well as reopening strategies. Now, we already did put guidance out for summer camps and for schools. But we're going to keep refining that, keep adding to that so that we can help people along, because we do need to get back to school. There are ways we can do that safely. I know we as parents want to see our kids get back to school. Not that we
some sooner than others, right?
Exactly. But it's important. It's important for our kids to get back to in-person learning also.
Well, thank you, Secretary Azar.
Yeah, thank you. My pleasure.
You just watched Newsmax TV, America's fastest growing news channel, now in 65 million homes. Get Newsmax TV on all the major cable systems, or go to newsmaxtv.com and click on the Find Newsmax tab to locate us. Remember, Newsmax TV, we're real news for real people.